Good afternoon, and thank you for tuning in to this latest community briefing on COVID-19 and our local response. Joining me again is interpreter Margie Propp, and I want to say thank you, Margie, for being here to provide your services to the public. We want to remind everyone that you can tune into the latest information on our website, covid19.lincoln.ne.gov, to learn more about the latest ways you can protect yourself, your family, and our community. At this point in time, the number of people who have lost their lives in Nebraska to COVID-19 numbers 10. And on behalf of all Lincoln residents, I want to extend my condolences to the friends and family of those who have lost loved ones. Yesterday in Lincoln, we issued a recommendation that residents wear cloth face coverings when out in public to help prevent the spread of the virus. This is because we're learning more about the novel coronavirus every day. And what we know now is that even those individuals who are pre-symptomatic or asymptomatic have the capacity to still carry the virus and spread it to others. Again, a cloth face covering is meant to be a supplement to and not a substitute for the other important prevention strategies that have been recommended by local health officials, such as physical distancing, frequent hand washing, and of course staying home as much as possible. You may notice that I am not wearing a cloth face covering at this moment. One of the downsides, of course, is that the voice can be a bit muffled when you have it on. So right now I am sharing this room with only just a couple of other people, and we're maintaining the safe 6 feet distancing requirements recommended by the health officials. But in the interest of making my voice more clear and to be able to get out important public safety and health messages, I am not wearing them during these briefings. But I can assure you that if you see me out running on the trails or at the grocery store or at the pharmacy, I will be wearing a cloth face covering. And I urge you all to do the same. This recommendation has prompted some questions. Where can I get a face covering? How long should I wear it? How do I launder it? Should I throw it away? You can find answers to many of these questions at our website, covid19.lincoln.ne.gov, or you can also call the health department at 402-441-8006 for more guidance. And we appreciate the care that people are taking and wanting to continue to comply with the latest recommendations of our local health officials. Moving on to today's situation. We have had 3 new cases confirmed in Lincoln today, bringing the total number of lab confirmed cases to 34. 2 of the new cases are men in their 40s, and both are community acquired cases. The 3rd case is a man in his 50s, and that case is still under investigation. So of the total 34 cases in Lincoln that have been lab confirmed, 18 are travel related and 13 are community spread, and 3 remain under investigation. Our topic today related to COVID-19 is larceny from autos. Our main objective, of course, in conducting these briefings is to inform the public and help them stay safe and healthy and well during this pandemic. The coronavirus has created a new reality for all of us, and it has really altered our daily routines, and it's got us evaluating new risks because of it. As the city, here at the city, we continue to monitor trends in our data to protect the public. Here's something new we're seeing. Lincoln has seen a significant increase in reported larceny from autos, or that's theft of personal property from automobiles, during the past 6 weeks, from February 17th to March 29th, 2020. The charts provided on the screen show a comparison of what has occurred this year in comparison to weekly averages over the past 5 years. And here to provide more details and a more thorough explanation to discuss this data and the current trends is our Chief of Police, Jeff Blymeister.
Thank you, Mayor. I appreciate the opportunity to be here with you today. And as mentioned, we continue to modify some of the crime types that we're watching as the spread of coronavirus comes about into our community. And larceny from autos is one of those. In fact, we've seen a 99% increase when compared to the 5-year trend previously. But I want to empower everyone within the community. There is things that we can do about this. So many of us are at home. We're at home spending a lot of time, and here are some actions that you can take. First, just go out to your vehicles that are parked in your drive or in the street and remove any valuables. Take a double check. Make sure that there's nothing left behind. And as you're walking away, make sure and lock that car. Because this is something that is preventable, and we want to stop the cascading effects of when a larceny from auto occurs. So in theory, if a wallet is stolen and it contains a credit card, oftentimes those credit cards are immediately used at a series of different businesses across our community. That particular action requires follow-up on the part of our officers, and they have to make contact not only with the individual who was victimized in the crime, but at all of those businesses as we attempt to gain information to identify and locate the persons responsible. We watch many, many videos of larceny from or theft from vehicles occurring. And what is true in all of them is it is a crime of opportunity. There'll be 2 or 3 cars parked in close proximity. The individual responsible will be lifting the door handles on one, the second, finding that they're locked, moving on to the third before it's open. And that crime of opportunity is what presents itself. So once again, we are seeing this increase. There is something that we can do about it, and I appreciate all of your efforts to make that happen.
I might also add that it's important to lock your garages. No one's immune to these thefts. My husband's bike was stolen from our garage just in the last few days, and it is just so important to take these key strategies to protect your home and your property. So we're going to run through a few of them. We want to first encourage you to continue to lock your car. It's such a simple task, but if done, you can really prevent the loss of important items. And we would again say, don't leave anything valuable in your car. Sometimes if people can see valuables in their car, they have more reason and incentive to break into your vehicle. So just be smart about where you keep your belongings. These simple thefts not only have a monetary cost, but they have a compounding cost to those who are impacted by theft. The cascading effect of a stolen wallet, of course, includes time to get a new driver's license or to freeze your credit and debit cards with your bank and to wait for those to be replaced. No one wants to be dealing with these hassles on a good day, and certainly not during a time when most people and some businesses are modified their operations and are trying to stay home. Please keep in mind the advice of our police department. Remember that 9 p.m. routine of securing your vehicles and garages if you have them. And just as we are relying on others to do our part to stop the spread of the virus, each of us can make an impact to limit the number of theft from autos by doing our part. We'll conclude today by sharing some good news. We appreciate residents who are following the recommendations of our healthcare professionals and are staying home as much as possible. You are helping us flatten the curve and make progress in our fight against COVID-19. Our traffic data reflects the efforts you are making, and Lincoln Transportation and Utilities tracks this data 24 hours a day. The governor today in his press conference suggested that Lincoln and Omaha compete with each other for the lowest traffic counts, and Lincoln is happy to take up that challenge. I want to add that traffic in Lincoln is down approximately 40% by our measures, with the largest drops of 45 to 50% taking place during the morning commute. We're experiencing the most traffic during the lunch hour, and that's traffic at that time's only down about 20% from normal levels. But we hope this means that that's actually our residents trying to support our local restaurants and getting their takeout, making that effort to keep those restaurants, keeping them managing through these difficult times. And even in this significant time of significant change and adaptation, we also see that life in the city goes on in many ways, in its old ways. One of those is street construction. Major street projects are underway on South 40th Street, West A Street, and East Van Dorn. We have a traffic signal and turn lane improvement project underway at 70th and A Streets. And if you want to continue to follow progress on this front, you can track the street construction at streets.lincoln.ne.gov. Another major government effort that also continues is the U.S. Census, and a big thank you to all of you who have already responded online or by phone. In fact, our state, county, and city self-response rates are all better than the national response rate at this time. The national response rate is about 45.1%. Nebraska's rate is 50.8%. That ranks us 6th in the nation. And we are doing even better than that in the city of Lincoln with a self-response rate of 56.7%. And countywide, we're at 57.1%. And that is 12 percentage points above the national average. So thank you for what you're doing. This is, of course, a spot of good news because the census is so important to our future. Census data determines how more than $675 billion in federal dollars are allocated. And we want to make sure that our city, county, and state receive the resources that we need to serve our growing population. That's going to be more important than ever before in the wake of COVID-19. It's also important to note that in a college town like Lincoln, students who live off campus should be counted in the city where they attend school. The pandemic is creating some challenges for the census. That's why it's important that we all do our part to respond now online or by phone. Again, this is the first time that we've been able to do a digital census. What a great opportunity to utilize that mode of reporting. In mid-April, census forms will be mailed to those who have not yet responded. The final step has traditionally been to send out census workers to go door to door to reach those who have not responded. Let's not make them do that. That's been delayed for now, and we don't want to. We want to reduce the need for door to door efforts by anyone at this time. So please complete the census online, by phone, or by mail. It's easy, it's confidential, and it's extremely important. And that website is census.gov. Finally, today is World Health Day. The World Health Organization has declared that 2020 is the International Year of the Nurse and Midwife. Nurses and other healthcare professionals are at the forefront of our battle against COVID-19, often at great personal risk to themselves. I hope you will join me today in thanking nurses and midwives for their hard work, their dedication, and bravery, wishing them well, and continuing to practice physical distancing measures that help ensure their safety and honor their courage. At this point, I'd like to open up to questions from the media. I see we have a number of you present virtually, so I'd be happy to take questions at this time, and of course the Chief of Police is still here as well.
Oh, we have a question for Chief Blymeister.
Okay.
Chief, tell us about this blue wristband.
So the blue wristband that I have on is a process that we have implemented, and it's kind of one of these things that we're learning from organizations within the United States that have experienced more of a proliferation of COVID in their communities. And what it is it signifies that each morning when we come in and begin our shift, we're taking our temperature and we're answering a series of screening questions. And while, to the mayor's point, we know that there is the potential, all but small, that asymptomatic individuals can provide or transfer this disease to others, it is another step to ensure to our coworkers and also to the public that we're taking this very seriously, and we value the health and well-being of our employees. It has to be taken once again to what the mayor is talking about. This is one process. When you combine that with face coverings, with social distancing, with good hand washing, and staying home when you're sick, that's the things that we all can do to ensure the welfare of our workplace and also of the people that we serve. Thanks.
Mayor, this is Bill Shammer with 1011. Quick question. You opened your briefing by saying you are wearing your mask when you go out on a run. Is that the expectation, not just when you go to grocery stores or pharmacies, but that we should also be wearing these if we're out on Lincoln's trails or exercising outside?
For me, I have a, running partner, and so we're running 6 feet apart from one another. We're on like either side of the trail, and we're wearing masks because, again, if air droplets are a vehicle for passing the virus, you're running, you're breathing heavier. So I feel that is an appropriate use of a face covering, particularly when exercising around, in proximity of other people. But again, combining that with social distancing, good hand hygiene, hand washing, and that is how, by being thoughtful and very deliberate about each step we take when we're around other people, and you do pass other people on the trails, it's not a bad idea to consider wearing a mask if you can't always be 6 feet away from others in public. Other questions?
It's Riley from the Journal Star.
Hi, Riley.
Hi. Have any clusters at employment centers, businesses in town emerged to the knowledge of the health department at this time, or are they just individual cases kind of scattered?
Really, we don't have Pat Lopez here today because she's on a phone call that was very important, that a lot of local health officials are a part of today. So if I could get back to you on that question, I don't want to misspeak. I am not currently aware of any employment clusters, but again, for the latest information, I'd feel better if we had one of the health department folks answer that question.
I'm Allie. I'm a student at UNL, and this is a question for Chief Whitemeister. According to data from LPD's daily crime log, the department is taking more disturbance and suspicious activity calls each day following the mayor's local emergency announcement. Why do you think that these type of calls have increased?
Allie, that's a great question, and I appreciate you taking the time to be part of this particular conference. And so the calls that you're talking about, the disturbances, are things that we are continuing to track and monitor, and they are one of our higher volume calls for service. Making a causal relationship to the directed health measures that have been implemented, or even just the voluntary directives that people are taking, is one of the things that we continue to explore through the Crime Analysis Unit and through the research branch of the Lincoln Police Department. Because we want to know those answers, we just don't have them in front of you. Hopefully that answers the question to the best of my ability. Any clarification I can provide?
That's good. Thank you.
Have any other further questions?
Mayor, Andrew Ozaki from KETV. I was just checking with you. So Pat's not there today to answer questions about the investigation in the state penitentiary.
No, I'm sorry, she's on a call. But I can assure you that for all of the cases that are referred to the Lincoln-Lancaster County Health Department, they take that investigatory role very seriously. They're working around the clock, making contacts. They don't know what a weekend is anymore, so they are doing their best because, of course, their goal with contact tracing, that's one of the key strategies we have. We've been fortunate with our lower numbers in this community that our public health capacity is such that we do contact tracing, and so we are actively looking to see who the individual may have been in contact with and then making sure that those folks are in self-quarantine.
Mayor, just so you know, Andrew has some pretty specific questions and I'm working.
Okay.
He's emailed them to me, so I'm working with health.
Okay. And we'll make sure that we get you comprehensive answers to your questions, and Diane Gonzalez has just advised me that she's working to get those for you as we speak.
Great. I mean, have you been in contact with the Department of Corrections about possibly needs that they might have for facilities, or I guess use of their hospitals for inmates who may get extremely sick, ill in this particular process?
I haven't personally been in a conversation with the Department of Corrections. I know that our health department is trying to make sure that they are available as a resource to anyone in the community that has questions or wants to consult them for guidance and advice. Certainly the State Department of Corrections has the state health officials as well to draw upon for their guidance and recommendations.
Mayor, this is Bill Sherman again with 1011. A quick follow. Are you familiar with the Douglas County dashboard that they have where they break down all the cases by zip code, by gender, even by race?
I understand that they have a dashboard, and I believe that our health department is planning to try to share more information, like a graph that is being prepared that shows the number of cases by age range and by how many are male or female. So they are working to try to produce a little more kind of trends or categorized information for public consumption.
Do you know if zip code would be included in that data?
I don't at this time, but I can find out for you, Bill.
Mayor, I had another question. It has
Yes.
to do with, I guess, having your 911 centers, I guess, be able to tell first responders or police when they may be entering a COVID-19 situation.
Well, I'd be happy to back up to give you some more details, but we had early on, thanks to the leadership of our chief and of course the LFR as well, plans put in place for doorway triage, but that doorway triage starts at the dispatch. So I'll let him provide some details about that.
Hello, Andrew. The doorway triage process is something that has been utilized for quite a few weeks. I can get you the specific of when we started that. And it has, like many things involved with COVID-19, it's evolved. We're getting better at it. We're getting better at providing that particular information to the first responders in an effort to protect them and in an effort to protect those they're responding to. Can I try to answer any more specifics you may have?
How did you get around the HIPAA, concerns that you might have in red flagging or flagging, potential COVID situations?
That's a great question. Doorway triage is something that we're asking individuals when they're calling in. And so those particular questions are specific. Are you experiencing symptoms? And that's really what it has to do with, the symptoms of fever, cough, sore throat, or shortness of breath. And that information is then relayed to our first responders. And we don't believe that it is in violation of any kind of HIPAA because really it goes to the residence itself and not to the individual. But those are definitely concerns that we continue to monitor, especially as there is greater number of people that have tested positive within the city of Lincoln and in Lancaster County, and we're working through that.
So you haven't asked the health department to release any of that information to dispatchers, to red flag or anything like that?
So your specific question is not really about doorway triage and those processes, but have we taken those identified in Lincoln and Lancaster County by the health department and implemented them into our computer-aided dispatch system? And the answer to that is no. I can tell you that there has been conversations surrounding that, as there has across the nation, and we're really trying to find that balance, because as you would know, even though an individual tests positive today, after a period of time, more than 80% of those individuals are going to stay at home. They're going to recover from the COVID-19, and trying to manage that particular data of when the symptoms have left and when they're no longer possibly communicating that disease to others is a fine balance. Good question.
And Chief, you might remind people that we have a video that people can watch what to expect when you come to the door.
Yep. Gonzalez reminded me that Lincoln Fire and Rescue, along with the Lincoln Police Department, has produced a video, and really we're just trying to educate those that we're serving on what they can expect when an officer arrives in the midst of this COVID-19 pandemic.
Chief, this is Allie again. I found that DUI calls have nearly been cut in half following the mayor's local emergency. How would you say the city's COVID-19 measures have affected that rate of crime?
Another great question, Allie. The mayor mentioned earlier that traffic studies completed by Lincoln Transportation and Utilities show that traffic is down by more than 40%. We have similar data that measures traffic crashes, showing a reduction at almost that particular percentage point. Why? Because there's less cars on the road, less people out, more people that are complying with the requests, really because they have the mindset they want to keep not only themselves safe, but everybody they're interacting with safe. And that reduced traffic volume corresponds with the reduced number of driving while intoxicated arrests.
Any other questions? Okay, well, thank you so much for helping us get out our public health message and share with you during this community briefing. We'll be back again tomorrow at 3:30, and stay safe and well out there.